For this Rotary year, we go by the theme of Rotary Shares of RI President Wilf. And as our way of giving life to the annual Rotary theme, our club has come up with our newest and latest signature project. The world's first self-contained mobile surgery unit. It is our way of giving life to our commitment to service above self. The project envisions to provide surgical procedures to our less fortunate brothers and sisters in the far-flung communities in the Philippines. Our mobile surgery unit is equipped with its own water system, power system, and waste disposal system. It is considered the world's first because our project leader, Dr. Jim Sanchez, is the author of this technique known as local regional blocking or local anesthesia as a means of doing surgery for changing lives, improving lives, and saving lives. All that we needed then was a mobile surgery unit, and we have this container van. What you're seeing now was fashioned from a trash container van. It has been converted into a modern surgery room with the most modern equipment in surgery.
Many of us have been on many surgical missions organized by individuals, groups, and organizations. We wanted to continue and sustain such noble activities. In the latter part of 2004, we have thought of putting up a well-equipped mobile surgical operating room because of the difficulty in organizing such activity. Just like the Chinese Volunteer Fire Brigade, it is always ready for deployment when needed. The Rotary Club of San Francisco del Monte, through the leadership of President Louis Pangulayan, its very supportive and energetic officers and members, made this dream a reality. The Rotary Club of San Francisco del Monte's DOCS Mobile Surgical Unit is in principle a well-equipped operating room on a container van. Its design, its structure, and the equipments and supplies, as well as the system, replicates that of a modern operating room in a 3- to 5-star hospital in Metro Manila. The goals of the Rotary Club of SFDM's DOCS Mobile Surgical Unit are: 1. To do surgical missions in areas and regions where the surgical facilities, supplies, and expertise are wanting. 2. To help indigent patients who need surgical procedures that can be done under local anesthesia or nerve block. And 3. To train surgeons and anesthesiologists, those that join the missions and those in the local areas, on the technology of sensory nerve blocks. The Rotary Club of San Francisco del Monte's DOCS Mobile Surgical Unit has the following: 2 operating tables, 2 operating room lights, 2 emergency lights, 2 electrocautery machines. As standby, it has a suction machine, an anesthesia machine, 2 oxygen tanks, a pulse oximeter, a volumetric infusion pump, and stethoscope with blood pressure apparatus. It has many sets of surgical instruments with an autoclave and liquid sterilizing solutions, sterile drapes, supplies like anesthetic solutions, sutures, gloves, gauze, blades, syringes, needles, what have you. We have stocks of intravenous fluids, and it has an e-card which contains materials and medicines for any emergency conditions like heart attack, asthma, allergic reactions that may arise. Examples: defibrillator with EKG, oxygen mask and tubes, an ammo bag, There are emergency medicines available when needed, like antihypertensives, vasopressors, bronchodilators, antihistaminics, anticonvulsants, and pain relievers. Some of the medium and big surgeries that we have done in this mobile surgical unit will be shown. In the recent study conducted by the Philippine College of Surgeons, many regions in our country lack the surgical facilities and supplies. Worst, there is a severe shortage of surgeons and anesthesiologists because of the exodus of these professionals to the USA and other countries. The Rotary Club of San Francisco del Monte's DOCS Mobile Surgical Unit is not an answer to these problems. However, the project in its entirety is nothing but a sincere attempt of a dedicated team of surgeons with Rotarians to make life-saving, life-preserving, life-improving surgery available to our less fortunate brothers and sisters.
My dear friends, this is a work in progress. We need your support. We need your help. Join us as we give life to the theme of Rotary Shares through this project, the world's first self-contained mobile surgery unit. Greetings to all Rotarians. He who profits most is he who serves. I am Louis Pangulayan.
I'm Dr. Juan Jim Sanchez Jr.
This is our team. This is your team. We are the Rotary Club of San Francisco del Monte.